The first order of business is to approve the resolution authorizing committee expenditures for the 118th Congress. What? All right. Good morning. The Senate Committee on Health, Education, Labor, and Pensions will come to order. All right. We did it officially. We've done that. All right. Now, the first order of business. What? All right, Warren, what? Okay. All right. I think we are going to maybe have a quorum later on. We may not, but I think we'll be able to proceed. Is that right?
I'm okay with that.
Okay. What I want to do today informally is to try to bring people together to get a discussion of where we would like to go. I've had the opportunity to speak to almost all of the Democrats, some of the Republicans, and I look forward to speaking to others to get a sense of what your priorities are. Obviously, there are going to be major disagreements on issues, and that's called democracy. But I happen to believe that there are going to be areas where we can work together. And I look forward, honestly, to doing that. So what I'd like to do now is just kind of lay out some of the ideas that I have, and then I'll give it over to the ranking member. He'll do the same. And then we'll go around the table, and people can take a few minutes to express their priorities. Let me begin by thanking Senator Murray. There are a number of hearings going on right now, meetings. She's not here. But I really wanted to thank her for the excellent work she did as the previous chair of this committee, and to thank Senator Burr as well. Patty held the chair in the middle of the worst public health crisis in modern American history, and I am amazed and appreciative of the incredible number of hearings she had on COVID and other related issues. So she deserves all of our thanks. The title of this committee is Health, Education, Labor, and Pensions. And obviously within that very broad jurisdiction, which impacts virtually every American, there is an enormous amount of work to be done. So let me tell you kind of what my priorities are within that broad scope of work. In terms of healthcare, in my view, we have a broken and dysfunctional healthcare system. We spend twice as much per capita on healthcare as do the people of any other country, twice as much. And yet we have 85 million Americans who are uninsured or underinsured. We have some 500,000 people every year who go bankrupt because of medically related debt. Just think about that for a moment. You get leukemia, bad enough, then you go bankrupt because you can't pay the medical bills. And on top of all of that, we have some 68,000 people every year who die because they don't get to a doctor on time because they can't afford to go to a doctor. And as bad as the general healthcare system is, the primary healthcare system is struggling even worse. And when I talk about primary care, I am including the need to address the horrific mental health crisis. I don't know about you, but I go around my state, and no matter where you go, to schools, to police departments, wherever you go, it's mental health. It is worse than people perceive it. It was bad before, and the pandemic has certainly made it a lot worse. So we need to look at mental health, and obviously the opioid crisis, which I know is hit New Hampshire very hard. It has now spread, thank you, we now have it in Vermont, and all across this country. We lost over 100,000 people last year to opioids. But on top of all of that, we have nearly 100 million Americans who live in areas where it is difficult to access primary health care. Nearly 70 million live in areas where it is difficult to find a dentist. And I want to talk, during the course of our time here, talk about dental care, which is a serious problem. And then we have 150 million people who are finding it hard to find a mental health provider. So the question that we want to deal with, and we're going to deal with it pretty soon, we've got a hearing coming up, is how does it happen when we spend so much money per capita on healthcare? We don't have enough doctors, we don't have enough dentists, we don't have enough nurses, we don't have enough mental health care providers, we don't have enough pharmacists. So that's an issue that I think we got to lay on the table and see what we can do about that. And I should say that in the midst of all of that, Patty, you're late. I said some very nice things about you.
Thank you.
All right, you have to go look at the video and, all right. But despite all of those problems, the insurance companies made over $60 billion in profits last year. And then another issue that we will deal with, and I know there are divisions on this committee on that one, is it is my very strong view that it is a woman who has the right to control her own body and not the government. That is an important health care issue to many of us. And I believe the Dobbs Supreme Court decision was not only wrong, but way out of touch with where the American people are on this subject. In my view, we must codify Roe v. Wade and protect the reproductive rights of women. So yes, if you look at all of the issues in front of us on health care, we have an enormous amount of work to do there. Part of that issue is prescription drugs. And interestingly enough, we did a little bit of research on this, but as both former President Trump and President Biden have both noted, we pay by far the highest prices in the world for prescription drugs. And in some cases, we pay 10 times more than the Canadians and people around the world pay. What to me is totally insane. And I want to, and again, these are issues I hope we can come together on. Somebody here tell me if you think it's rational that somebody cannot afford a prescription drug their doctors prescribe, they get sicker, they end up in an emergency room, maybe they end up in the hospital, maybe they die. Does that make sense to anybody in any way? And I am more than aware, and let's be clear about this, we're big boys and girls here. The pharmaceutical industry has 1,700 paid lobbyists roaming the halls of Congress, former leaders of the Democratic Party, former leaders of the Republican Party, well-paid, sophisticated people. I have seen polls, I would say to my Republican friends, polls that were just done with Republicans. And you know what the top issue on the Republicans' agenda, at least in those polls? The high cost of prescription drugs. This is not a Democratic issue. It's not a Republican issue. The American people are sick and tired of being ripped off by the pharmaceutical industry, who make zillions of dollars every year, pay their CEOs exorbitant compensation packages. Question that the American people are asking us, do we have the courage to take on that power? And I would hope that this committee, in a bipartisan way, does. In terms of education, for years, Senator Murray has been a leader in demanding that we address a child care system that is, in my view, in total disarray. In Vermont, it costs over $15,000 a year for a kid to go into child care. Think about it. How does a working class family afford child care, $15,000? And by the way, in Washington, D.C., it's probably twice that. All right? We profess to love our children, yet we have the highest rate of childhood poverty of almost any major country on earth, and a child care system which is disarray. People don't have enough slots. Many parts of the country, you can't get your kid into child care, and we pay child care workers abysmally low wages to do some of the most important work in this country. So this is not only an issue of kids and parents, it is an issue of the economy. People can't go to work, mostly women, if there is no available child care. I would hope very much, that we begin finally to address this issue. I know Senator Murray has worked so hard on it, but we're not going to let it drop. It's an issue that has got to be addressed. The other issue, and I'm going to be holding a town meeting on this on Monday night, is the low pay of teachers, public education in general. We are losing tens of thousands of teachers because of low pay and because of very poor working conditions. I believe strongly in public education. Teachers do some of the most important work in America, and they must be adequately paid. And on top of that, we must keep our promise to the disability community and our public school system, and fully fund the Individuals with Disability Education Act. And we look forward to working on that issue as well. And I know Senator Hassan feels strongly on that issue. I think we can all agree, and I think this is an area of bipartisanship. We want our young people, if you don't go to college, to be able to go out and get jobs in the trades. We desperately need plumbers and carpenters and electricians, and yet we don't have the training capabilities of doing that. We need to expand apprenticeship programs. I know there's something Ranking Member Cassidy has talked about, others have talked about. Let's see how we can work together on that. In terms of labor, health education, labor, We are living in a country where 60% of our workers are living paycheck to paycheck, and millions are working for starvation wages. The time is long overdue to raise the minimum wage to a living wage. Federal minimum wage is $7.25 an hour. I trust that nobody thinks that that is acceptable. Further, at a time when workers all over this country are organizing unions, we cannot allow large corporations owned by billionaires, companies like Starbucks and Amazon, to violate federal labor law and engage in illegal union-busting activities. And that's an issue I feel very strongly about. People have a right to organize. We should not tolerate major corporations engaging in union busting. And among other initiatives, we must also pass the PRO Act. In the last Congress, the U.S. House voted to make sure that rail workers in this country had at least 7 days of paid sick leave. In the Senate, that amendment had the support of every Democrat but one and 6 Republicans. And I am pleased to report to everybody that as a result of mounting public pressure, a very large rail company, CSX, has agreed to provide some guaranteed paid sick days to some of their 5,000 workers. So we're making some progress on that, but these profitable corporations must be held accountable, and other companies must do the same. And rail workers are not alone. We must finally end the international embarrassment of the United States being the only major country on earth not to guarantee paid family and medical leave or paid sick days. Furthermore, in the year 2023, it is absurd that millions of women do not receive equal pay for equal work. We must pass the Paycheck Fairness Act. And there's another issue I would hope that we would have bipartisan support. Artificial intelligence and robotics are having and will increasingly have an extraordinary impact on the workforce. And we've got to take a hard look at what the workforce will look like in 20 or 30 years, and we intend to do just that. Pensions, last part, but not leastly, not unimportant. We must do everything we can to expand, not cut, defined benefit pension plans in America, which unfortunately are becoming an endangered species. It is unacceptable to me that nearly half of older Americans have no retirement savings and no idea as to how they will ever retire with any shred of dignity or respect. Some of the other issues I want to look at is in an aging society, how do we improve the Older Americans Act? These are just some of the issues that I think that are out there. Bottom line is, if you look at health, education, labor, and pensions, these are issues that impact virtually every American. They are enormously important. Many Americans are giving up on democracy. They're giving up believing that their government can respond to their needs. And I hope that this committee, where we will clearly have disagreements, will be a place where people are saying, you know what, they really are talking about the issues that impact my lives. And maybe they disagree. They will treat each other with respect. It's called democracy. But I would hope that we will go forward aggressively in addressing the real issues facing working Americans. And with that, I yield the mic to Ranking Member Cassidy.